Dr. Elliott, would you like to get started?
I think so. All right. Thank you, Mackenzie. Well, good afternoon, everyone, and thank you so much for joining us. Welcome to the Arizona chapter of the American Academy of Pediatrics panel session on supporting safe and healthy schools. I'm Dr. Sean Elliott. I am the chapter's medical director of infectious diseases and vaccinations, and also a pediatric infectious disease specialist here in Tucson at Tucson Medical Center. We are really grateful all of you spending your very precious time to join us toward the end of the day. And we think we have, I hope, a very impactful panel session, very much in line of supporting our students' health, not just with the COVID pandemic, but for other very important issues as well. We're going to start the session with me giving just a very brief sort of clinical update, where we at in terms of the pandemic, and I think more importantly, what are the challenges facing our students as a direct result of the pandemic. Then I'll introduce our fabulous panel discussants and have some pre-prepared questions to ask them to go through. At the end of that, our wish is to share with you a toolkit that this team have prepared, hopefully to help you with discussions, dialogue, and outreach. Very much a helping us help you, help us back and forth, again, to protect the health of our students. And then, if time permits, we'll finish with a question and answer session. And as or if you have questions, please feel free to put those into the question box using the toolbar at the bottom. And if we don't get to those questions, we will absolutely get answers to you from our panel discussants afterwards. So to start with a brief overview, again, I think everybody is painfully familiar with the pandemic, with SARS coronavirus 2, COVID-19 starting actually in China in 2019, becoming a worldwide pandemic as declared by the World Health Organization in mid-March of 2020, and up to today, early April 2020, where we are just recovering from yet another surge of yet another variant, the Omicron variant, and looking at worldwide impact of a sub-variant, the so-called stealth Omicron or the BA2. The numbers you see in front of you are staggering, both in terms of what we have experienced over the last 2 years and a bit, but also just in worldwide historic context. To date, actually, as of yesterday afternoon, from the Johns Hopkins epidemiology site, the United States has counted over 12.8 million cases of COVID-19 since the start of the pandemic, which is actually, this is just a huge number, and that's actually children. I haven't even gone over the millions upon millions of adult cases, but in the States, 12.8 billion cases in pediatric patients, which accounts for just 19% or almost 20% of the total caseload since the start. Because it sometimes is easier to think of in terms of rates or prevalence, in the pediatrics world, we record that as number of cases per 100,000 people of pediatric age, meaning from birth up through age 18. So that rate for the States is just over 17,000 per 100,000 pediatric age range patients. In Arizona, unfortunately, our numbers look even a little bit worse. Our total pediatric cases to date are almost 425,500 cases, which is over 21% of our total caseload, both adults and kids combined. So our rate per 100,000 pediatric patients is just over 23,000 per 100,000. So that has put us, since the start of the pandemic, in the top 5 states for a good part of the pandemic, and currently in the top 10 states in terms of the pediatric attack rate. So if you're having the perception that there have been a fair number of students out of school or out of community or out sick in Arizona, that perception is valid. Big surprise. Further, there's been a significant number of hospitalizations, and this is important because I think everyone realizes that COVID-19, by and large, has been a disease affecting adults, both young, healthy adults, as well as older adults. But unfortunately, the underrepresented minority, those being children, have been significantly affected as well. So here in Arizona, just over 108,000 hospitalizations, which is a hospitalization rate of 4.3%. That's huge when you look at other routine respiratory illnesses in terms of hospitalizations versus attack. And a very unfortunate number, which is the number of deaths either directly caused by or related to COVID-19. And that number to date is 63. Now, about a third of those are directly caused by the viral infection itself. So medical complications in hospital of children who presented with COVID-19. That means that the other 2/3 are what are called related fatalities, related deaths. And those are almost always trauma associated. So completed suicide, intentional or unintentional drug overdose with a fatality, motor vehicle accidents, firearm deaths, et cetera, and so forth. So all these in some way are attributed to the social and societal challenges of the pandemic. What I think sort of bring you into the school perspective, where I think we've noticed one of the biggest sources of challenge, and I'm not telling you anything you don't already know, has been that the whole complex balance between virtual learning versus attempting to maintain in-person attendance and then the hybrid models. And struggling, of course, to provide excellent education, keep the students on target with curriculum, and also keeping them engaged. All of these have been major challenges. To the next slide, please, Mackenzie. So what are the impacts? And you know, I think if I open this up right now, we could come up with a whole bunch more. So I've tried to sort of summarize these into major categories. Of course, the educational impacts. Our students are nowhere near we would like them to be in terms of testing as one, sort of metric of how they're doing, certainly in terms of just general class performance, curriculum achievement, et cetera, and so forth, but also have been the major impacts on socialization. My wife, just by full disclaimer, teaches high school theater at Cholla High School, Southside Tucson, so one of the more underrepresented student populations and high needs. And she and other teachers have described the students as going feral this year. So the number of violent encounters on campus, fights, sexual assaults, et cetera, and so forth, all I think directly related to the students not being in a social setting and forgetting how to interact with one another. Of course, I think we're all quite familiar and personally scared of the mental health impacts. I'm a practicing physician. I care for patients in hospital. And at any point, including right now today, almost a quarter of our hospitalized children and adults, adolescents, are hospitalized with attempted suicide, drug overdose, depression, anxiety, psychosis, the whole 9 yards. And overwhelming the number of available inpatient psychiatric beds. So the mental health impact, not just in Arizona, of course, this is countrywide, it's global as well. All of these, of course, are a huge direct negative repercussion of the pandemic. And we're not going to fix any of these things, obviously, today, but just we're hoping to empower ourselves and share experiences about how to get students back into the healthcare setting. And not that doctors and nurses and nurse practitioners have all the answers, but they are a source of continuity, and certainly a way of assessing and providing preventative healthcare. But the numbers and the percentage of pediatric patients who have dropped out of the healthcare system, who are no longer coming to their primary care provider, is astounding. To the point where Arizona is number 47 in the country in terms of its ability to provide and continue to provide primary care visits. So we're hurting, folks, and this is not a big surprise at all. One of the major points of our toolkit is to partner with the schools as a source of access to the students and to their families to try and get those kids back into preventative healthcare. And by doing that, to provide resources for counseling, for therapy, for medications if that's necessary, but to assess what the mental health care needs are and then to act on those. To support education about self-care, about nutrition, for example, physical activity, how to engage more productively, both through the school setting and the family dynamics, such as that is, to prevent healthcare disease and also to support healthcare outcomes. To perform the screenings, both screenings for mental health disorders, but also for learning disabilities, for physical ailments, for medical disease, for infectious diseases, et cetera. And then finally, and not certainly not last, but our vaccines. And here we're talking not so much COVID vaccines, although of course we'd like to support those as well, but routine vaccinations. Again, Arizona is doing very poorly compared to other states in the country in our ability to vaccinate otherwise healthy children with routine vaccinations. And it is no accident that already around the state, there have been clusters, and I will even use the word outbreaks, of such vaccine preventable diseases as whooping cough, pertussis. There even have been several measles scares. Chickenpox is next. So all of these things are, of course, are devastating negative consequences of the pandemic. And as we hopefully start to emerge, fingers are crossed, et cetera, and so forth, from the overwhelming burden of the pandemic and start to look around us, our hope is to re-engage into preventative health care. So next slide, please. So that is sort of the setting into which we wish to introduce our panelists and to ask some important questions about their experiences and how perhaps we can all work together to introduce them. And panelists, as I introduce you, please feel free to turn on your camera and microphones. So starting with Dr. Mark Hajjornstadt, who is Executive Director of the Arizona School Administrators, Nadine Miller, nurse, and many other things, who is our representative from the School Nurse Organization of Arizona. She also is President and Director of Health Services for the Mesa Public Schools. Sharon Sweeney, also multiple titles there, who is a public health nurse and representative from the COVID-19 surge response team, that being through the Arizona Department of Health Services and the Arizona Immunization Program Office team. And then we were really fortunate to have Linnea Later, who is a student representative. Linnea is a sophomore at University High School here in my town in Tucson. And I'm just super thrilled to have the students' perspective as well, especially because we feel that it is through the eyes and I think also importantly, the voices of our students that we can empower a change to get our students leading their families back into preventative health care. So I think that's it for the slides. Oh, sorry, housekeeping. Always got to have housekeeping. Typical Zoom things for the presentation at this point. Only our panelists can be seen and heard. Attendees will be remaining muted. I do have questions prepared for the panelists, and we'll go through those. And as we're going through those, if a question strikes you or if you want a clarification, please feel free to go ahead and drop that into the Q&A box, which you'll see under your toolbar at the bottom. We absolutely wish to be respectful of your time. So if we're running out of time, then we'll go ahead and keep a running record of those questions and then get those to the panelists and get answers back to you as we go. So I think that is it for the stuff. Let's get started with the panel session, everyone. This is going to be so exciting. And actually, Linnea, if it's okay, we're going to start with you, not to put you on the spot, but we would love to hear what it's been like for you and your friends and classmates as a student over the last 2 years. There's been so much misinformation, disinformation, airwaves just being clogged with all sorts of garbage, as well as in the middle of that, some truths. How has misinformation affected your conversations, and how's it been with your classmates and friends?
Yeah, so I'm currently a sophomore in person at University High School in Tucson, but I ended my 8th grade year online, started my 9th grade year in my bedroom, and graduated in my living room. So I didn't have any friends, and so I didn't really, because I moved to my new high school really without any of my old friends. And so I didn't really make friends online. It was kind of hard. And when I did get the chance to talk to people in a breakout room, I didn't really want to talk about COVID because I was scared of like conflict, or I just wanted to talk about normal teenage things and make some friends. So in that sense, I haven't really like encountered misinformation because I never really talked about it. But personally, I've just seen some stuff over social media, and my parents have raised me to find information from credible sources and use my brain and all that. Particularly my dad, hi dad, who's watching. But it has affected my family in Sweden, they're experiencing COVID differently. And I've just heard some things from them, and it's been interesting. So talking with them, and the toolkit, which we'll get into later, I think would be really good, especially in class, because I do think like it's a really necessary thing to talk about since it's happening. And I think it could really help minimize like the triggers around COVID, because especially I have very strong opinions. And if it were brought up in class right now, I'd probably get really like aggressive. And so I think it'd be really important to bring it up. And the toolkit has some really, really important points and sources that I think would be good for everyone and could open people's eyes to perspectives they haven't seen, even my own.
Oh, that's great. Thank you. And just to sort of follow up on that a little bit, do you have a sense that your classmates would be open for a conversation sort of led through the toolkit, or is that sort of like similar? I'm tired of hearing about it. I just don't want to go there.
Yeah, I actually really do think so, especially at UHS, my high school. I think my school would really be open to that, especially if it's because we haven't talked about it at all. And I think people have kind of forgotten about it. Our mask mandate's been lifted, and I think people just think it's over, but it's really not. And so I think something like that would actually be really helpful in my school.
Oh, great. Thank you. Thanks, Linnea. All right, Dr. Hajjornstadt, you're next. When the pandemic first started, it threw all of us into a great big tizzy and a whirlwind and all those fun things. And I'm sure we all know schools at varying levels were unprepared for an emergency of this kind. How have you seen, or what ways have you seen schools try and rapidly develop emergency protocols, operation plans since the pandemic began? Oh, I think you're muted. There we go.
Come and start talking when you're muted.
Yeah. Rule number one of Zoom.
I want to thank the Academy for putting on this webinar today. And you're correct when you say that school suddenly closed in March, around March 13th of 2020, not that we were keeping track of the date, and we were not prepared to suddenly pivot to virtual instruction. People did the best that they could given the circumstances. We've learned a great deal in the ensuing 2 years. As I like Linnea's phrase, I graduated from my bedroom, or from my living room, excuse me, and we had ceremonies of graduation in many different places. One of the things that we can do now to with the thoughts and learnings of the last 2 years to keep people safe yet, because we like to believe it's over, but many of us really realize now we're going to be living with this and possibly other variants and other things that we don't know about yet. We're going to continue living in that world. It's COVID's world now, and we get to live in it. But we can continue many of our new procedures in place, especially some that will not be outlawed by misguided legislation. Cleaning procedures for classrooms, gymnasiums, cafeterias, and other facilities, we've greatly improved them with better equipment, supplies, and procedures. Classroom practices in terms of spacing, hand washing, and interactions are much improved, and those can stay. Simple things like the sharing of pens and manipulatives. We have learned how to do these things differently and in a more sanitary manner. Not sharing is caring. And who would have thought we would say that? But that has reduced the spread of many infections. Going outside more often, taking learning there. That has reduced, that has allowed us to utilize the open air, and that not only creates exercise breaks, but it provides healthful ventilation and interaction. We can continue that. All of those are positive improvements that can stay in our routines. Even more importantly, when you ask about planning, is our mantra is hope for the best, but plan for the worst, because hope is frankly not a strategy. Plan for the unknown. Now, many of our districts have been meeting monthly since the pandemic began to plan for any needed transition. So we have systems already in place so that if you have to quickly transition from face-to-face to virtual, you can complete it, well, maybe not automatically, but close to it. You keep a stock of PPE, personal protective equipment, on hand, ready to go if you need it. Not ready to be ordered, but on hand and there. You provide for continuing professional development related to online or virtual operations. So now there's no excuse not to have teachers and everyone else trained. You ensure that all your constituents, your communities, know the benchmarks that you follow that would cause you to suddenly shift to online instruction. Those are known and communicated. You run through a variety of scenarios, so each team member knows their role during transitions, whether they work in payroll, food service, transportation, special education, or as teachers or nurses. You plan for the ongoing costs of things like air filters, masks, hand sanitizers, boxed lunches, or many of the recognized mitigation strategies that you will need. Finally, communication is the key. The communities and the stakeholders all need to know these benchmarks. They need to know them well. So every platform must be utilized for communication. Some people are best reached on Facebook, some on Twitter, others on Instagram, or by phone or text messages. Our websites need to be kept current. Some districts have gone door to door with flyers as well. The mantra is no surprises. Students, staff, parents, community partners, we are all in this together, and that's the message that must be out there. We must act as one.
Great. Thank you, Dr. Hajjornstadt. Absolutely 100% agreed. And sort of taking on into the next stage of that, I think we've all experienced creation of online learning platforms, experiencing our students being out of school for long periods of time, either virtually or not virtually, just not being there. The whole issue of parents sending their kids to school with or without masks, all these things and so many more have impacted student both quality of education, but also equity and inclusion, and affected our most vulnerable learners super, super hard. Sharon, can you share some of your thoughts and experiences on how schools can close some of those gaps, which seem to still be an opportunity for improvement?
Sure, thanks. Thanks for inviting me, and thanks for holding this panel discussion. Yeah, you know, it's really interesting. When I first read this question on Friday, I thought, okay, you know, it's about underserved and underrepresented groups of people. But then when I thought about it over the weekend, and additionally, there were 5 articles that came out from the CDC about adolescent health during COVID on Friday, I would argue that almost everyone is a vulnerable person, every student. One of the articles mentioned that 37% of students were depressed. Another article, and still continue to have problems communicating. Another article on suicide, adolescent suicide, and suicidal ideation mentioned that 19.9% of students during the pandemic thought about taking their own lives, and 9% tried. So I would say that almost everybody is vulnerable and, you know, can use some TLC during, you know, what everyone's so eager to get back. But like I've heard, it's not really over. And, you know, but how do we go forward? And so what I would say is that this has been, and I'm new to, I came back into the workforce because I wanted to be part of the solution, which for this pandemic, which I hope will be the only one in my lifetime. And I found an opportunity, I think, to be part of the silver lining of this pandemic, which has given us all, and there are so many dedicated and passionate people about public health, and this is Public Health Week. So what a perfect time to have this this panel. But you know, I think what it comes down to is we all want to get back to business as usual, but it's not going to be business as usual, and it won't be for those students who have been affected. And it might not necessarily be the students that the schools would identify as underserved and underrepresented. You know, and I think that's really important, especially with mental health. So the silver lining in all of this, and what I've noticed in my 5 months with the Department of Health and the Immunizations Program Office, is that it's been an unparalleled opportunity for people to collaborate with one another. And there have been a lot of new hires. And, you know, we're still trying to make a matrix of collaboration, and it's really working. It's finally like coming in. You know, there's a wonderful person who was hired as a school liaison to bridge the gap, or, you know, make better communication with the Department of Education and the Arizona Department of Health Services. We have a vaccine equity coordinator. We have an administrator right at the top level for equity. So I think there's a lot that is in process and a lot that can be done. And I would say that you know, when we talk about schools, you know, that's like a more, you know, at the administrative level, but we're each part of a community, and this community of Arizonans. And whether we're the school nurse, and I know the school nurses are working quadruple time, but whether we're the school nurse or the bus driver or another student, we can, and the one thing that one of these studies did show, it was the lack of connectedness, which made these students vulnerable. So if we can at least connect on, you know, a person-to-person level and meet people where they are, I think we could do a lot of really good service for our community. And the last thing that I'll say is, going forward, you know, there are going to be vulnerable people physically and emotionally, and, you know, they may want to come back with masks, you know, and that might be hard when no one wants to wear a mask and people have really strong feelings, even not in schools, but even in stores. Like, you know, you get the side eye or the glare if you're wearing a mask, or if you're not, you know, there's people on both sides that have very strong opinions. But I think if we can just meet people where they are and be open and honest and willing to listen, and also be ready with some facts and data, that will help all of us. Thanks.
Thanks so much, Sharon. Thanks for coming back to help out. Oh my gosh, talent well appreciated. You know, it's interesting, and sort of leading into the next question, which is going to be for Nadine. You know, my wife has shared that many of her students have lost family members in the pandemic, and several even have lost immediate caretakers. So parents, or sometimes, you know, the grandparent who's the caretaker. And it's just astounding to think of the emotional impact and just the wellness impact that must have on a student who is still struggling to work on concrete response, you know, to grief and loss. So kind of similar to that, we know that, of course, the flip side of that is that students do their best when they're feeling their best. And there's a big gap between, you know, loss, depression, suicidality, et cetera, and feeling on top of the game. Nadine, from the school nurse perspective, because you're in the trenches, how do you see promoting and supporting preventive healthcare in the school setting, and how does that maybe impact, or can it impact, on overall student success in the school?
Well, yes, thank you. Thank you for inviting me. I do think that we actually, you know, have quite of an impact in that, and it's been quite a challenge for this last year and a half, because we haven't done a lot of things that I think we do to help kids that are missing, you know, those appointments with their PCPs, those kids that are not getting their immunizations, their screenings. So, you know, we have tried real hard this year to catch up on some of those kids that we might have missed for hearing screenings and vision screenings and blood pressure screenings, and get those kids back to referred to their primary care physicians, and get those kids back in that healthcare thing, because we know a lot of kids have been missed with their regular routine follow-ups that happen usually at a normal rate for kids. Following up with that, obviously their immunizations. We are seeing a lot of kids that are non-compliant with their immunizations. So really pushing hard back on parents to say, I understand that you've been afraid to go to places, but places are opening up and you can get these resources, and there's places that you can go to really get these kids in, because we also do know that, yes, we're going to end up seeing varicella chickenpox breakouts, pertussis breakouts. They're coming. And if we don't get a handle on this, we're going to have some other complications along with the COVID and the other things and the flu and just the normal things that we see every year that are going to start to really impact our kids. Because we know if our school age kids probably aren't getting those vaccines, probably our babies aren't either. So we really want to help these families to find resources and get them back to where they need. Along with that, a lot of, many of the school nurses do a lot of communicable disease presentations, whether that's hand washing for our kindergartners and our first graders, whether that's dental screenings and having some of our groups that come in to help us with the dental screenings and the things that help to promote good dental care. Kid with a toothache doesn't learn well, so we want to make sure that we're getting those screenings done and identifying these kids and getting them sent off to their dentist or to referrals to get them going. So I really think that has been a huge impact also on some of our kids, because we have not been able to do that because we have just had so many kids missing. And so, yes, the nurses have worked hard and they have been on overload with all the COVID reporting and then trying to catch up on some of these kiddos that we have missed over the last couple of years. So it's real important that the school works with their medical teams, works with their school teams, really to try to encourage these parents, whether that's with the counselor or the teacher, saying, hey, your kiddo's not doing well in class right now. It might be because they failed their vision screening. How can we help you? What do we need to do to get them referred and get them some glasses so that they can be successful in school?
Oh, yeah. Fantastic. Thank you for that. And I'm actually going to sort of jump back to Sharon to sort of follow up on that. So that's occurring at the level of the schools, at the students. Sharon, we know the state is behind or is trying to get the kids into routine preventative health care. What sort of things are you and your team at the health department doing to sort of empower that same message, that same mission?
Thanks. Yeah, great question, because we were 46 and we slipped one to 47th, which of course no one wants to hear. So yes, that is a big priority at the immunization program office. And we have a program for some children called Vaccines for Children. So we have some initiatives going through that program to encourage well child visits and also hopefully immunizations. And Nadine, yes, even some of the babies have missed some of their immunizations, which of course we would like to see that be better, but people understandably have not wanted to go out anywhere, even to a physician's office or a practitioner's office. So we have a lot of private and public partnerships going on right now at the local level, at the jurisdictional level, at the county level. And we are doing things that have not been done for a while, like school-based immunization clinics. We're trying to work on that to make it as accessible for people as possible. And our vaccine equity coordinator is working triple time to make sure that we reach everyone that we can to get Arizona back up to speed.
Great, thank you very much. And yeah, I think we're all trying to do the same thing from different perspectives, and it's just a matter of time and messaging and communication. I want to go back to Linnea now and just sort of get the students' perspective. Linnea, we have an audience of school professionals who I think really want to hear about your experiences in the pandemic. Is there someone or some group of someones that have been really helpful in getting you through the pandemic? And what suggestions might you have to our administrators to help improve the student experience?
Yeah, absolutely. Okay, so as for people, my dad has been here to talk with me about my frustrations and everything, and he relates to me on a lot of stuff, especially considering he's critically immunocompromised, which has made school pretty hard for me, and especially in the beginning when I came back from being at home for over a year. but I advocated for myself, and I talked to my teachers about seating charts and things like that that made me more comfortable with people who had better masks and things like that. So teachers, most of my teachers, not all of them, but my teachers and my friends and my dad have really helped me, and just my family as a whole, actually. Something I would just really suggest is like, okay, so little backstory. My English teacher, she came in to this school year, she was new, and she asked us to write her a letter of stuff that we wanted her to know about us. And so I got a chance to explain myself, and so did everyone else. And so I think just for it'd be good for students to have a chance to like explain themselves, and for people who are shy or more shy than I am and won't really speak up for themselves. So I think that would be helpful. And yeah, so it's gotten better, but it was pretty hard in my experience.
I can imagine. Oh, thank you so much for sharing that. So I think our hope then is to sort of to harness the power of the students wish to be heard and all the steps being taken locally, regionally, the state, and also to protect everyone's critical energy and resources and avoid burnout, et cetera, and so forth. So I think now's a good time, if we can, Mackenzie, to bring up the slides again and introduce the toolkit. And everyone will have access to this. The hope is just that there are some things here which can be used in different ways for everyone to use as they need. Just briefly, in the toolkit, there's this overview document, just sort of briefly describing what the elements are, what's available, and giving links to those. And then there's a PowerPoint presentation for any of our school professionals or others for that matter who wish to introduce the toolkit to their teams, the educators, support staff, administrators, and even students who might wish to be student leaders in this. On the next slide, there's a flyer which can be shared with our parents and caregivers. Again, just sort of reminding and also perhaps re-emphasizing the importance of well-child visits, that they're not just, wasted time spent in the day, but truly there are many achievables which are important to hit in those well-care visits. And in the absence of those, that things just tend to go south. So that this flyer describes that. There's an email template, again, depending on how active and perhaps overt our school partners may wish to be, but we've created an email template that could be customized just to send out to the caretakers and parents as well. And also a calling script. Again, now this is even more time to, we realize nobody has time to do this, but the hope is that if there is an empowered group of either parents through an organization or administrators or educators, that we sort of give you these as a way to reach out to the student body, reach out to the parents and families, and sort of drive it forward. And then, of course, everyone likes really good social media graphics, and these have all been created and vetted with multiple interactions at the chapter level. And our hope is that you can consider them as free to use as you wish. And again, just sort of like hitting all of the healthy messaging, which with a professional advertising company has been shown to engage our public, our populace, and our students. Okay, and then there's always, yet more resources that one can use. Here, of course, is a list of those. These are all vetted in terms of quality evidence, evidence and output, which is, I think, productive for effecting a change and avoiding a lot of the challenging interpretations of facts, if I can say that politically correctly. On the next slide, this is, I think, a very big awakening for many of us, and of course, there's no reason why it should not be so. But our students are our voices for the future. Of course, I think we all know that, and I at least have been guilty sometimes of simply giving that lip service. rather than empowering students, empowering our teens to be able to perform the outreach, highly much more effectively than I could ever do. So we've created a toolkit specifically for student groups, whether it's student government or student ambassadors or leaders identified at a school body who can be champions for peer-to-peer education. And we've given them information and talking points and also the COVID-19 Mythbusters, sort of a list of questions generated by students all over both at the state and also other parts of the country, which frequently come up in those times, as Linnea was saying, when conversations might actually need to occur, how to answer those questions. And you'll see in there some very open, honest, transparent answers to, for example, fertility issues associated with the COVID vaccines, and why that actually might have been fake news. So our hope is that the toolkit can be used by all of you in any way that you wish to help empower both a return to physician visits, of course, well child visits, but also just to try and get back to the new normal and establish partnership of schools, students, and families for overall wellness, overall student health, and to allow us as a sort of conduit to healthcare providers to help in that conversation. So with that, I think we'll stop the presentation, but opened up for questions and answers. And I'm just going to see, of course, now I have to read my glasses. Okay. Oh yeah, thank you for that question. None of the kid pictures showed kids wearing masks. We went about 19,000 rounds back and forth about that, and ultimately made a difficult decision. Our hope is that these toolkits and the partnership with health can go past the pandemic. In part, that's futuristic thinking or future tripping, as some like to say, but we did not wish the message to be held back by a negative association with the pandemic once we get to the point where hopefully the numbers are low. So in partnership nationally with AAP, the pictures are without masks to try and be a forward-thinking movement and message which will go past and forward past the pandemic. So thank you for that. All right, other questions? We had one in the chat. Oh, okay, great. So one of the questions, are these available in Spanish? And I believe we are working on those, absolutely. Okay, so two questions. First is targeted more for schools in the underserved communities. Have we explored or previously done programs to have on-site mobile clinics to have well child checks, physical exams on campus? This would be similar to what we're doing with some of the Arizona dental programs for grade 2 through 6 and the schools under Title I. So specific to that question, several of the county health departments have very active mobile health clinics. It's a matter of resources. I know that Maricopa and Pima County, to name two, are very active in that. I believe we're working as another part of this team approach on identifying other resources at other counties than Pima and Maricopa, which would satisfy that specific response. Because you're absolutely right that the mobile outreach, I think, is a huge way to provide resources in under-resourced areas. The next question, actually, Sharon, anything that you're aware of at your level for mobile health outreach? I don't want to
Yes, and there are some, and there have been some, mostly for COVID vaccines, but there are also some that are, because normally you wouldn't give routine vaccines during, at the same time, but there have been some plans to do that, and some may have actually happened. So there is more, we're trying to think outside the box as much as we can about getting everyone on board with what they need.
Okay, great, thank you. And this next one may others chime in, by the way, if you have answers to these as well. This next one may be for Sharon as well. Next question is regarding the school health office staff. Will the health services department review and or push for more health aides to have medical certification, like medical assistants, nursing assistants with pediatric experience versus only a high school diploma and on-site training? So that's more of a systemic issue.
I can't really speak to that directly, but I do know that the health equity team is looking into different trusted messengers and trusted people that would serve especially underserved and underrepresented communities. And our tribal partners are in that as well.
Okay, thank you. Nadine, did you have some
Dr.
thoughts?
Elliott?
Yeah, please.
Yes, I think part of the question is she's asking is what are we going to do for healthcare in our schools? Since there's no mandate for a school nurse, there's no mandate for any requirements for your health aide or whoever you call that. That could be the secretary, that could be a mom, that can be anybody you want, because there is no requirements from the state of any kind who is in that health office. And as we are seeing more and more involved kiddos, I think it's becoming more and more important that we try to, as a state, determine who those people are in health offices to try to support the health and the needs of the students that we're seeing with the increase of diabetics, with the increase of asthmatics, with the increase of kids that are going to have complications possibly from COVID, those kiddos that are coming in with more specialized medical needs, whether that's tube feeds or trachs or things that, 25, 30 years ago, we didn't see many of because they didn't survive some of these kiddos, but now they do and they're in school, and we don't always have the resources in the schools to support them without having school nurses in the schools.
Yeah, absolutely. Thank you for that. So it looks like we are actually running out of time, which I knew would happen. I do have to say before we close, for Linnea, you've got a ton of support from the attendees. I don't know if you've been looking at the message in the chat box, but truly thank you for bringing your perspective as a student to this very important conversation. And thank you to all the panelists as well. I greatly appreciate your time. And for those who have attended, also thank you for your time. Please let us know how we can work with you to help get student health back on target. And if we did not get to your questions, we'll distribute them and send them back to you after the fact. So with that, I think we'll bring this to a close. And thank you, everyone. Have a hopefully safe and sane rest of week. Thanks, everybody.